So there are dimensions of relational labor that negatively affect mental health, increased stress, increased burnout. And that's when clients take advantage. They're talking about being taken advantage of. When they want to be too close, or when they want to invade too much on your private life, or when they think that you're a cleaning lady. I have a lot of, I'm constantly trying to educate my mother about, when my father was ill, about what the role of the personal support worker was, because my mother would, think that she had come in to, sort of, clean the house and, do the laundry. And I'd sort of say, no, Mom, look, she's tidy up. She's changed Dad's sheets. She can tidy up the bathroom after she's given Dad a bath. Do the wash the sheets and the towels. But it's she has nothing to do with your kitchen or or the windows that need washing or the light bulb that needs changing. And so I don't know if I was ever successful about that or not. But that's a problem when, in terms of causing people stress, because they don't have the time to do that and it's not their job. Also, difficult clients, for just one quote, for example, like some clients, if you tell them, don't smoke while I'm here, they will just tell you, well, it's my home, I have the right to do that, and I want to do what I want in my home, so you just have to go along with them. You can't argue with the clients. And, it is a problem because people are working in their client's home. It's not a workplace, and they don't have control over the work environment in the same way as if they were in an office, and that can be kind of stressful. I mean, you can also run into problems with clients, caregivers, the children who are angry, who are sort of making demands on you. It might often be difficult clients. A client who has Alzheimer's disease and is aggressive or etc. So difficult clients cause stress and emotional exhaustion, and also hazards in the home, unsafe working conditions, and infectious diseases, superbugs, secondhand smoke, unsafe neighborhoods. I mean, all of these factors cause a lot, can cause problems to both mental and physical health. I remember looking down and having a little flea on my ankle one day. I left when I left my bag, it was full of fleas. I knew it needed a fumigator when I went. Oh, I guess she's talking about her pants. I knew that I needed a fumigator when I went to cross my legs, and went, okay. I know an OT who brought cockroaches home in her bag. She said it crept out of her bag when she put the bag down in her home. And there's that other one, hepatitis. Recently, I took my graduate students into a public housing building in downtown Hamilton, and we were doing a little survey of the older adults in the public housing building, sort of. Of course, many of the students had come from, the middle-class homes, and there was a huge problem in the building with bed bugs. So every client they went into, they got an earful about the bed bugs and how they couldn't get rid of the bed bugs. We're having a big problem in Hamilton. I think you are in Toronto as well. So they were really freaked them out. But I was thinking, people do this every day. They go into these, into apartments or homes where there are, a lot of hazards in the home. That's just a little one, but it's one that can be a bit distressing if you happen to bring it home with you. There's our dimensions of physical labor that actually also contribute to mental health problems. And, for example, injuries on the job and work-related injuries on the job, and including many of the injuries in home care are injuries moving clients. So in our study, in our survey, we found that 12% of all respondents reported having at least one work-related injury in the past year. And that was pretty high. In fact, about half that had actually reported it to WSIB, but these were serious enough to, cause them to be off work for a while. So most common were sprains and strains to the spine, arms or hands, and shoulders and necks. And a lot of it could have been due to just an injury moving clients or to just the constant strain of the physical work related to care labor. Other issues that caused stress and emotional exhaustion, crime on the job, it could be physical injury or a theft or whatever, and sexual harassment. I alluded to this a little bit earlier, that sometimes it's with older adults who have dementia, and they no longer have the ability to sort out what's sort of appropriate and inappropriate behavior. So you can imagine you're sort of giving a gentleman a bath, and and he's sort of lost his inhibitions. It can be quite delicate, I guess. And interestingly, a lot of the home care workers, they've devised a lot of different techniques or ways of handling that kind of situation. Sometimes they don't even describe it as sexual harassment, but in fact it really is, even though there's a problem with the client sort of knowing better, I guess. So I just want to conclude by a few comments. So the home care in the community shouldn't be treated as the poor cousin of acute care. It's a way of downloading expensive health care costs to the community sector. This is being done at the cost of visiting home care workers who've seen their workloads dramatically increase, while at the same time witnessing a casualization of their labor and declining pay and benefits. Though I cannot help but argue that most strongly for policies that would promote a more permanent workforce by guaranteeing full-time employment for those who wish it, and implementing a benefit systems that would include pensions and health care benefits, our research shows that while these policies would improve intrinsic job satisfaction, improve recruitment and retention, they do not necessarily lead to the improved mental health of home care workers. Rather, policies that address heavy workload experienced by staff and policies that recognize the value of caring and emotions, the caring and emotions work that visiting home care workers do would go a long way to increasing the personal accomplishment they feel on the job and decreasing their stress and emotional exhaustion. So I just wanted to sort of suggest some sort of policy implications at three different levels: at the organizational level, and kind of at the provincial level, and at the federal level, that might help to improve the mental health of visiting home care workers. So at the organizational level, policies do not recognize the importance of the relational aspect of work, often emphasizing the importance of completing instrumental tasks rather than the caring aspects of the job. For example, when cutbacks result in reductions in time allotments for clients, visiting home care workers have little time to accomplish the emotional rather than the physical part. These types of policies are in direct contrast to the perception of home care workers who feel that the emotional part of their work is more important and more difficult than the instrumental aspects of their care. Our previous studies and those of others have demonstrated the important role that organizational support plays in increasing job satisfaction and decreasing stress. Mental health would be improved by making workers more supported by their managers and supervisors through more frequent and regular contact, sharing of information about the organization by providing more educational opportunities, by giving workers a greater voice in decision-making in their agencies, and by an organizational philosophy of respect and care to employees and clients. And many agencies do these things already, but others are not as good at them, so I'm suggesting that this is an area where some agencies could improve. Control over work will increase personal accomplishment and decrease job dissatisfaction and stress. For visiting home care workers, this may include giving more flexibility and autonomy to nurses to determine when they can see clients, and giving personal support workers more input into the care plan. Providing visiting home care workers an opportunity to meet with and consult with and mentor their peers is also an important way of increasing their mental health. At the provincial level, despite research that shows that home care can be the most more cost-effective for some clients. It can decrease ER visits and decrease the number of ALC beds for older adults. Provincial governments are reluctant to adequately fund home care. Increasing funding for home care would not necessarily mean increasing the burden of health care dollars, but rather a shifting of money from the hospital and long-term care sector, with a recognition that putting more money into home care may save money in the other two sectors. At the federal level, well, unfortunately, home health care is not an insured service under the Canada Health Act. Rather, it's funded through the Canada Health and Social Transfer Act to provinces. Home care has become, as I've said, a poor handmaiden to the better funded medical system. Despite numerous research studies, political lobbying, and commissions and reports recommending that home care become a universally insured service, this hasn't happened. By making home care services available, accessible, comprehensive, and under public administration, issues such as adequate funding and heavy workload can be addressed. In summary, a change in the very nature of home care work can only happen with a supportive public policy environment that recognizes that inherent benefits to both to the consumer and to the healthcare system of providing health care in the home. Because the public sector is the major source of financing for home health care, the key to improved financing is what the public sector is willing to pay for home health care and the conditions that the public sector sets in financing arrangements.